Hi everyone, my name is Courtney Bohr, and I'm going to be going over the HIV/AIDS epidemic. What is HIV and AIDS? HIV, or human immunodeficiency virus, is a virus that damages the immune system and attacks the CD4 cells, or T cells. T cells are a type of white blood cell that helps the body fight off infections. If left untreated, HIV can develop into the most severe form of AIDS, or acquired immunodeficiency syndrome. By this point, the immune system is too weak to fight off other infections or diseases. If AIDS is left untreated, the life expectancy is about 3 years. There is currently no cure for HIV or AIDS. Understanding the disease. HIV appeared in the United States around the 1970s, but it was not made publicly aware until the 1980s. In 1982, this new immune system disorder had affected over 335 people and had killed 136 of them. At this time, the CDC used the term AIDS for the first time and defined it as a disease at least moderately predictive of a defect in cell mediation immunity, occurring in a person with no known cause for diminished resistance to that disease. Officials initially called this disorder GRID, or gay-related immunodeficiency, since the disorder appeared to affect mostly homosexual men at the time. In 1983, the public considered this disorder the gay disease, and it was even called the gay plague for many years. Understanding the disease, Part 2. The cause of AIDS was identified in 1984 as the HIV virus. In 1985, the FDA licensed the first blood test for HIV. The first antiretroviral medication for HIV was created in 1987. In 1991, the red ribbon became the international symbol for AIDS awareness. The FDA approved the first oral, non-blood HIV test in 1994, and not even 2 years later, the first home testing kit, as well as first urine test. By 1999, AIDS was the fourth biggest cause of death around the world. In 2012, the FDA approved the pre-exposure prophylaxis for HIV-negative people. Today, more than 70 million people have contracted HIV, and about 35 million have died since the start of the AIDS pandemic. Causes of HIV. HIV is a variation of a virus that infects African chimpanzees, simian immunodeficiency virus, or SIV. Scientists suspect that SIV jumped from chimps to humans through the consumption of infected chimpanzee meat. The mutation of the SIV into the HIV infection we know today was thought to have occurred as long ago as the 1920s. HIV can be transmitted through bodily fluids such as blood, semen, vaginal and rectal fluids, and breast milk. Causes of AIDS. AIDS is caused by HIV. A person that has not contracted HIV cannot get AIDS. A healthy person typically has a CD4 or T cell count of 500 to 1500. A person with AIDS has a CD4 or T cell count that falls below 200. Tests used to diagnose HIV. Antibody antigen tests. These are the most commonly used tests to diagnose HIV. Positive results can be shown typically within 18 to 45 days after someone contracts HIV. Nucleic acid test. This is an expensive and less commonly used test that is used for people who have early symptoms of HIV or have known risk factors. This test looks for the virus itself, and it takes approximately 5 to 21 days for HIV to be detectable in the blood system. Home antibody test. There are a couple home antibody tests. Those are such as oral quick HIV test, which is an oral swab test that provides results in 20 minutes, and home access HIV-1 test system. This test is a finger prick test that provides results through a licensed laboratory that usually has the results back by the next business day. Stages of HIV. There are 3 stages of HIV. The first stage is the acute stage. The second stage is clinical latency stage, or chronic stage. And the last stage is AIDS. Symptoms. Stage 1, acute stage. Symptoms of stage 1 are fever, chills, swollen lymph nodes, general aches and pains, skin rash, sore throat, headache, nausea, and upset stomach. The picture to the right depicts a skin rash as the first stage of acute HIV. Symptoms. Stage 2, clinical latency. Stage 2 symptoms consist of recurrent fevers, night sweats, fatigue, nausea and vomiting, diarrhea, weight loss, recurrent oral or vaginal yeast infections, pneumonia, and shingles. The picture to the right depicts someone with an oral yeast infection, consistent of stage 2. Symptoms. Stage 3, AIDS. The final stage of HIV symptoms consist of dark splotches under the skin or inside the mouth, nose, or eyelids, sores, spots, or lesions on the mouth, tongue, genitals, or anus, bumps, lesions, or rash of the skin, rapid weight loss, anxiety and depression, and some neurological problems such as trouble concentrating, memory loss, and confusion. The picture to the right depicts someone with lesions on their skin consisting of a stage 3 symptom. Treatment options. There is currently no cure for HIV. Treatment for HIV should begin as soon as possible. The main treatment for HIV is an antiretroviral therapy. Antiretroviral therapy helps keep HIV from developing into AIDS, as well as reduces the risk of transmission of AIDS to others. When treatment becomes effective, the virus will not be visible in test results, even though the patient still has HIV. HIV medication. There are more than 25 antiretroviral therapy medications that are approved to treat HIV. These medications are grouped into 6 classes: nucleoside reverse transcriptase inhibitors, non-nucleoside reverse transcriptase inhibitors, protease inhibitors, fusion inhibitors, CCR5 antagonists, and integrase strand transferase inhibitors. Treatment regimen. The U.S. Department of Health and Human Services recommends that a starting regimen begin with 3 HIV medications from at least 2 of the 3 drug classes. The combination of the HIV medications will help prevent HIV from forming a resistance to them. A healthcare provider will help a person choose their HIV regimen based on overall health, personal circumstance, and blood testing. HIV prevention. The most common way for HIV to be spread is through anal or vaginal sex without a condom. This risk can be lowered by a few precautions, such as getting tested for HIV, getting tested for STIs or sexually transmitted infections, the use of condoms, limiting sexual partners, avoid sharing needles or other drug paraphernalia, consider a PEP or post-exposure prophylaxis, considered a PrEP or pre-exposure prophylaxis. These are the sources I used for this lecture. I hope you enjoyed.